Hello, good morning, good afternoon, good evening everyone. Saan man panig po kayo ng mundo. Welcome to our episode number 100, our 100 webinar of the Stop COVID Deaths webinar series. Thank you for being part of our credible online community. Okay. I'm not sure if everyone is able to hear us. Thank you. Okay. And to all those po who have just discovered us for today, welcome po sa ating 100th episode. So maraming salamat po for bringing us through the journey po from webinar number 1 to webinar number 100. Thank you so much. For today's topic, viral hepatitis has been a major cause of mortality in the world. It's mainly due to hepatitis B and hepatitis C viruses. The main intervention po for prevention is childhood vaccination given at birth and in 3 doses. In the middle of the last month, I believe April 2022, the World Health Organization reported cases of acute hepatitis of unknown origin among children below 16 years of age. Yung pong sakit pong ito is very acute and severe and it prompts liver transplants sa kailan pong mga kabataan abroad. Sa pauna po, 163 cases were reported mainly from the United Kingdom, from Spain, from Israel, the United States, Denmark, Ireland, and other European countries. Simula po noon, ito pong mga kaso po that have been reported, medyo umaangat, dumadami po nung dumadami. Ayon po ito sa European Center for Disease Prevention and Control, and the worldwide report now is that ang numero po is at 450 cases, including 11 deaths in Indonesia, the Palestine, and United States of America. So for today's webinar po, ang tanong po natin ay mysterious hepatitis, may kinalaman po ba sa COVID-19. I'm Dr. Raymond Francis Sarmiento, Director of the National Telehealth Center of the National Institutes of Health, University of Philippines, Manila. Always a pleasure to be with all of you during our regular Friday lunch date po, and looking forward to Fridays because I get to share hosting duties with our adjunct faculty, international renowned public health communication expert, and the President's Special Envoy for Global Health Initiatives, Dr. Susie Pineda Mercado. Dr. Susie?
Hi, good afternoon, Raymond. Magandang hapon po sa inyong lahat. It's always nice to be with all of you and to hear from you on the chat. Sana nakikita namin kayo in a live audience, no? Pero hindi. And we're just so grateful that you're there kasi kung hindi po sa inyo, wala rin po kami rito. So we'd like to greet everyone who's watching also on the playback, whether that's Facebook or YouTube. And I have some special greetings. For those who send us messages that their week is not complete without watching Stop COVID Death. So Benilda De Gia, Jansen Paulo Cusi, Maria Patricia Ludan, at marami pang mga iba. So shout out lang sa inyo. Thank you so much for saying that. Nakakataba ng puso, di ba? We really enjoy putting the series together for you and really enjoy all your comments. And as we saw in the opening billboard, we have shifted a little bit in the sense na we are not just talking about COVID, but we will continue to talk about COVID updates. So that's for the C. Pero yung O is other outbreaks, and we're going to talk about that a little bit in a while. Viruses, infections, and disasters. So COVID. Pero hindi natin bibitiwan yung COVID kasi hindi pa tapos. No? Marami pa tayong kailangan maintindihan tungkol sa COVID. And Raymond, yung topic natin today, we'll be talking about that a little bit more. But this new hepatitis that is increasing in number is not being caused by the usual virus that causes hepatitis, and that's why we're going to talk about it. Kasi baka may connection sa SARS-CoV-2, hindi natin alam. So we've got a great lineup. We've got the best speakers again for you. And we all hope to learn today. And because all of you like to be updated on the news here and abroad, we are introducing a new segment which is called News Update. Okay, in the news, the state of Massachusetts has actually announced that they have their first case of monkeypox, which can be passed to animals and humans, is usually found in Central and West Africa. But health authorities in Europe have confirmed more than a dozen cases this month, and they are investigating dozens more. So some of these infections are noted in the United Kingdom, but they have no travel links. And there is a suggestion then that this could be spreading in the community, but we don't know yet. So the case in Massachusetts is the first in the United States, but monkeypox has also been reported quite recently in Canada, Spain, and Portugal. Monkeypox is a rare but potentially serious viral illness that typically begins like a flu-like illness with the swelling of lymph nodes and progresses to rash on the face and body. Most infections last 2 to 4 weeks. And in Africa, they say that this can come through the bites of rodents, mga daga, no, rodents and small mammals, or while preparing wild game. So by hunting down animals in the wild and eating them and not properly preparing that meat, this could be a mode of transmission. So the virus does not spread easily between people. Transmission can occur through contact with body fluids, monkeypox sores, items that have been contaminated with liquid or source, such as clothing, bedding, or through respiratory droplets following prolonged face-to-face contact. So we hope that this is not going to become a major concern for all of us, but just to let you know that this is currently being studied by health authorities in the United States and in Europe. Raymond, over to you. You've got some news too.
Thank you for your update, Dr. Susie. My update naman po will have to do, I'm not sure if our audience has been able to follow the news, but there is currently a crisis. At ang crisis pong ito ay may kinalaman po sa baby formula shortage, sa milk formula po na medyo kumukonti po. No? As of the first week of May, there is approximately 43% po na stock outs sa retailers nationwide, at least in the United States, and that is up from 31% from April to May, and around 11% since November. So the reason for this is multifactorial. There are issues stemming from the pandemic, disruptions in supply chains, shipping of myriad products, obviously those involving ingredients used in the baby formula, labor shortages that affected the industry. However, it really just ramped up when in February, Abbott Laboratories and also by the FDA in the United States, they did a recall of powdered infant formula produced in a Michigan facility because of reports of bacterial infection in several babies. So right now, the President of the United States has issued an emergency, sort of a defense order wherein they will be importing a whole lot of baby formula from European countries, and that's something that we hope to keep an eye out. Why is it important? There are babies po na maapektuhan in terms of their special needs. There are those na hospital na po and really are fighting po just to be able to get those infant formula. So that's for today's news.
Okay, so thank you very much, Raymond. No, I guess that's a sort of nudge for us to really promote breastfeeding, which is still the best for baby, and you can actually breastfeed up to 2 years old. Okay, so anyway, that's our news for today. We will continue to keep you posted and updated through our news updates. Okay, so back to our program. Raymond, ang topic natin ngayon, napakaganda, no? We've got a great topic, a great lineup. We are going to talk about hepatitis, the mysterious one, but we are also going to talk about the more rampant hepatitis in the Philippines, which we are endemic for hepatitis B and C. And what if this new virus comes to our country? No, parang they're saying this is because of an adenovirus. Another virus might be causing this upsurge in hepatitis cases, which do not test positive for the hepatitis virus. So we're going to learn more about that. And I think we have person on the street, Raymond, no?
Yes, Dr. Susie. So, especially for those who are joining us for the very first time, we usually set our discussion into context by all of us watching this very short video just to get the pulse of the common person on the street po. And the question that we pose, ano po ang inyong pagkakaintindi sa hepatitis? Please watch this.
Sa HEPA, wala akong masyadong wala akong masyadong information about that. Di ako ganun ka grounded when it comes to health diseases and concerns. Pero kapag based dun sa mga naririnig ko sa community or sa family ko, ang HEPA is more on, ang atake niya ay yung ay yung more on the inflammation of the liver.
Pagkakalam ko po sa hepatitis, yun po yung parang sakit po yata nakukuha sa pagkain. Tapos yung parang nagpabagong kulay ng tao.
Medyo onti lang po ang pagkakaalam ko sa sakit na to. Ang pagkakaalam ko po dito, isa tong sakit sa baga. Kung saan pinapahina nito ang baga ng isang tao. At ang sakit na ito ay nakakahawa rin.
Yung pagkakaalam ko po sa hepatitis ay yung signs po ay nakikita mo sa tao, yung naninilaw, yung mata, buong katawan.
Nagkakaroon ng HEPA ang isang tao dahil sa mga kinakain nito, lalo na sa mga street foods, alak, ganyan. Mostly ganon, yung masyadong exposure natin sa mga marurumi na inumin, na pagkain.
Nakakahawa rin. Sa aking pagkakaalam, ito yung natatransmit usually sa mga pagkain sa labas. Like for example, mga street foods, kasi yun nga, di ba, parang isa lang ng sausawan, ganyan, ganon. So,
Meron akong mga naririnig yung mga hepatitis A, B, C. Pero hindi ko alam kung ano yung mga pinagkaiba nila. Alam ko lang yung mga na may ganong klase ng pagkakaiba ito pagka-hepatitis.
Meron na rin, mga ilan na rin, mga kilala ko. Nakikita ko sa tulad po na naninilaw po yung mga katawan nila. Saka mata po, ganun.
Wala pa naman sa family or friends na aware ako na merong hepatitis.
Huwag nating hayaang magkasakit tayo. Kung yung mga bagay naman na pwedeng iwasan natin, kagaya ng maraming pagkain, yun ay iwasan natin kasi mahirap na sabay-sabay yung sakit eh. Magkakahipa ka tapos magkaka-COVID ka ba?
Huwag natin mayat-mayain yung pag-inom ng alak, ganyan. Kasi syempre, talaga, atay yung tama neto. At as young as we are now, or as early as now, sana tayo, maging maingat tayo sa mga kakainin lang.
Thank you very much, TVUP. Nawala. Nami-mute ako. Okay, thank you. Still muted? No more.
No, not
Thank you.
muted.
Okay, thank you so much, TVUP. It's always great to hear our interviews from persons on the street, no? Para mahuli rin natin how the public sees our topic, what we're talking about. And I think we've got some really good speakers today who are going to give clarity and answer the questions that they have asked. So over to you, Raymond.
Thank you so much, Dr. Susie. We'll just do some housekeeping po for those who are asking. Certificates of attendance will be given to those who have watched at least 50% of the webinar duration. We have already sent out all of the certificates for webinars 1 to 98 po. And we are still, may konti na lang po na isi-send out for webinar 99. We hope you have received your certificate. Those who are asking, we do not send out po an evaluation link. It's really just the one that's embedded here in the Zoom. And we hope you'll be able to participate. Well, all of you po, no? For today's webinar, as always, we will be employing a standard panel discussion format with presentations from two of our excellent speakers, and then followed by a Q&A session wherein we will be scanning po our Zoom, Facebook, and YouTube audience for questions, and especially if you are in the Zoom, if you are prompted to join po and ask your questions live to our experts, we hope you'll be able to, you'll not hesitate to join us po here as part of the panelists. And if you have any questions already, please put them in the Q&A box of the Zoom, and if you are in Facebook or YouTube, in the comment section of those platforms. And Dr. Susie?
Yeah, so for those of you who are curious, no, and want to look at this hepatitis of unknown origin, you can Google it now, no, while we're talking about it. Kung hindi niyo pa naririnig yung balita tungkol dito sa hepatitis of, you just Google that, hepatitis of unknown origin. Okay, so we're going now to the main part of our discussion, but before that, Raymond has a fun quiz for you.
Thank you, Dr. Susie. For all those who are outside of the Zoom, if hopefully you'll be able to join us, just open your browsers and go to slido.com, and then you will be prompted to input a code. May we have that on the screen at TVUP?
Hello? Hello? Hello?
Kumusta na kayo lahat?
Hi, I'm Doc Susie, the mini Doc Susie.
And I'm Doc Radar, the mini Doc Raymond. Are you ready to have fun? Simply open your browser to www.slido.com and enter your code to participate. We will discuss your answers during the panel discussion later on in the program.
We will have it flashing on your screen in a bit, and we look forward to your answers. Masaya at madali lang ito. Join na!
Thank you so much, TVUP. That's a really cool way of introducing our fun quiz. But may we have it on the... Yeah, there we go. For slido.com, you'll be prompted po to enter the code 5405717. That's 5405717, or you can also scan the QR code on the left-hand side of your screen. We have two questions, and these are as follows. Which of the following is or are associated with hepatitis? Option A, hepatitis A, B, and C. Option B, cytomegalovirus. Option C, dengue virus. And option D, all of the above. So we're seeing our participants po entering their answers po, no? But before we start, we'll move on in terms of dealing with all of the questions. We'd like to greet, especially those in the chat po, no? We understand that we have an audience from the Center for Kidney Diseases of the University of Santo Tomas Hospital. Maraming salamat po sa pagkumbinsi ng inyong nearby units for otorhinolaryngology, endoscopy unit, and your CT scan unit po. Maraming salamat po sa inyong patuloy na pagsubaybay. We're also like to greet all of those who are joining us from Kinarayan Elementary School in Narvacan, Ilocos Sur, Pasig City Science High School, Batangas Medical Center, from Westmin United Doctors Hospital in San Jose Occidental, Mindoro, from the RHU in Culyon, Palawan, Sorsogon Provincial Hospital, J.R. Borja General Hospital in Cagayan de Oro, Misamis Oriental, and the City Health Office of Cotabato City. Our second question, thank you. Lahat ba ng may hepatitis ay naninilaw o nagkakaroon po ng jaundice? Option A po ay yes, option B naman po ay no. So, please feel free to enter your answers po as we greet those who are joining us from the Chonin Hospital in Taipei, Taiwan, Mentari Intercultural School, Jakarta, Indonesia. So we saw, I think, Mary Liza mentioning kanina that the Indonesian Health Ministry has been investigating mysterious hepatitis that have killed 3 children in Jakarta earlier this month. So thank you for that piece of news. We're also joined by those from Bangkok, Thailand, Kanto City, Vietnam, Ministry of Health in Bandar Seri, Begawan, in Brunei, the Ministry of Health in Oman, University of Hail, Qasim University in Buraida, and Prince Sultan Military College of Health Sciences in Aldaran, King Saud bin Abdulaziz University for Health Sciences in Riyadh, all in Saudi Arabia, from Al Ain United Arab Emirates, Luigi Al University of Blida 2, Algeria, University of Fiji, Lautoka, Stockton and Burbank in California, the UP International Nursing and Healthcare Forum in Lexington in Virginia, the Philippine Nurses Association, Edmonton, Alberta, Canada, and St. Eustatius in the Netherlands. Maraming salamat po. Dr. Susie?
Yeah, thank you very much for everyone who's joined us. And I think we keep the poll open, Raymond, no? for those who still want to answer.
Yes, that's correct.
We actually feel that, these little questions that we ask help you remember and sort of have like what should I say, like a major takeaway. So we actually ask our experts to help us make the questions for you. Okay, so we are going to our presentation proper. And I'm very pleased to introduce our first speaker. As we said, we bring you the best speakers to the extent that we can. And natutuwa naman kami na ang dalawang guests po natin ngayon ay talagang they were very willing to come share their time preparing, because this is a very new development. No, it's a very, very new development that there's this hepatitis of unknown origin. And I think as we speak, the science or the knowledge about it is still developing, but they're willing to come share their knowledge and their insights on this particular phenomenon that's happening. So our first speaker is a pediatric gastroenterologist, former professor of pediatrics at the University of the Philippines in Manila, Philippine General Hospital, and an active consultant at St. Luke's Medical Center. We would like to welcome Dr. JULIET SIO-AGUILAR. Dr. JULIET, welcome.
Thank you for inviting me. Do I start now?
Yes, please go ahead.
Yes,
Go ahead. Take the floor.
I'll just share my screen. Okay, thank you very much for inviting me to this auspicious 100th webinar of the Stop COVID Death series, webinar series. Indeed, it is so timely that we can come together to talk about this emerging disease that many of us still do not know about what it is all about. And as we have mentioned earlier in the introduction, yes, there leaves so many things still to be unraveled in this particular case. And one of the original title of this webinar, as has been flashed, is really Mysterious Hepatitis, May Kinalaman ba ang COVID-19? And for our foreign attendees, the Tagalog question actually can be translated as, is COVID-19 related? Or is this mysterious hepatitis related to COVID-19? Well, I would like to add another dimension into my talk is about these mysterious hepatitis is how should we respond to mysterious hepatitis? I have no conflict of interest to declare, and this is my basic outline. So, having heard from the people in the streets about their knowledge or understanding of hepatitis B, I think we can say that a few of them have suggested the possibility of some non-infectious causes of hepatitis, but I think overall they have a rough idea as to what hepatitis is, and although many of them do understand it to be more from an infectious cause. And of these infectious causes, you will find that there are what we call hepatotropic viruses. In other words, these are viruses that have a special affinity for the liver. And there are non-hepatotropic viruses, which can be, which are those that are not really very much known to affect the liver, but can affect the liver. And you will find that of the non-hepatotropic viruses, EB virus or Epstein-Barr virus, Barr virus, cytomegalovirus, herpes simplex virus, Coxsackie virus, adenovirus, the topic that we are going to talk about, and dengue and even SARS-CoV-2 are all considered non-hepatotropic viruses because they can cause insult to the liver. Apart from viruses, we also have bacteria, fungi, and parasites. And of the non-infectious causes, yes, what was elucidated or shall we say suggested by one of the one of the persons in the interviewed in our video was about alcoholic causes. No? So besides these substances, drugs, alcohol, and toxins, you can also have other causes of hepatitis, autoimmune hepatitis, metabolic causes like related to obesity, no? Non-alcoholic steatohepatitis, and some vascular causes as well, like seen in cardiogenic shock. This, of course, is not yet the complete set of causes of hepatitis. There are a lot more, but I just selected the ones that are more critical. Okay, so you will know that the answer to our first question is all of the above. Right, let me just move on to present to you the significant timelines related to this mysterious hepatitis. On April 5 of 2022, WHO notified that there are 10 cases, or WHO was notified that there are 10 cases of severe hepatitis that involve children, 11 months to 5 years across central Scotland. And this was followed 3 days later by a report that there are actually about 74 cases already identified in the UK, which are of a non-A to E type of hepatitis. So this is a non-hepatotropic virus that is been insinuated to cause the disease. And subsequently, not only in the UK, but also in Spain, where they involved a greater spread of an older set of population up to 13 years old. About 2 weeks later, these cases have increased further, at least 169 cases in about 11 countries in the World Health Organization European region, and one country in the region in the Americas, North America, was actually identified as well. So below, you will find here that the bulk of the cases initially identified were in cases in the UK, been unbeknownst to people in the last quarter of last year, there were actually beginning cases already of this supposedly hepatitis of unknown origin that were reported in Alabama. And there was actually a statewide health advisory from October 2021 to February of 2022 about these 9 cases of children who were admitted to the Children's Hospital in Alabama with this supposed etiology of hepatitis of unknown etiology, but with concomitant adenovirus infection. So these were the 9 cases that were initially reported to WHO, and that was that I cited earlier that was reported in April of 2022 this year. So these were also the cases because of this growing number of cases that were seen in other parts of the world. These cases were now reported formally. These 9 cases were now formally reported in the US CDC website of the Morbidity and Mortality Weekly Report website. And sometime around 2 weeks later, the CDC and the US state health departments continue to see now more cases in the US, 109 cases of this type of hepatitis of unknown origin over 25 states, with more than half of them testing positive to adenovirus. And this would be more from the PCR. And over 90% of them were hospitalized, 14 required liver transplant, and there were 5 deaths. And this is the latest update. As of a week ago, worldwide, there are about 450 cases and 11 deaths. That gives us a case fatality rate of about 2.4% overall, with the US and the UK having the bulk of the cases. But I would like to zero in on the countries closer to where we are in the Philippines. There were about 15 cases of Indonesia that were reported in the website, and one case of in South Korea that could possibly be related to this mysterious hepatitis. And of these cases, and here are some of the highlights of the presentation. The range of cases, the age of range would vary from somewhere from 1 month old, as young as 1 month old, to 16 years old. But the median age would be around 2 years. And about nearly 7% of them will require liver transplant. Although the case fatality rate is around 2.4%, but you will find that 5 of the cases were in the US, 5 were in Indonesia, and 1 in Palestine. So I guess we may want to consider, the number of cases contributed, of deaths contributed by the Indonesian cases is to us a little bit of concern, because there were only 15 cases that were reported from Indonesia. I don't know the details about these deaths, but this could be more probably because of the reduced access to the severe cases that present with acute fulminant liver failure that may not have been given the opportunity to undergo liver transplantation. The clinical presentation, yes, notes that there are not only about a third of them will present with fever, and about more than 2/3 with jaundice and pale stools, and that there will be a good number of them, more than 2/3 of them will present with vomiting, and half of them with diarrhea. Only a small portion of them, about 20%, will present with respiratory symptoms, when in fact adenovirus can actually be more can present with adenovirus infection with respiratory symptoms. What is particularly characteristic is the markedly elevated liver enzymes in the order of more than 500 international units for both the ALT and the AST. And their findings are that they are all non-A to E, so non-hepatotropic virus, with 70% of them testing positive to adenovirus with a subtype 41F on PCR. And look at the associated viruses that were also picked up. And let me just show you with this particular slide. You will find that in the majority of the cases, the association would be with adenovirus, but about 15% of them nearly would also be associated with SARS-CoV-2, some with EB virus, enterovirus, CMV, human herpes virus, and even respiratory syncytial virus. So these are just some of the reports, that were taken from the cases in the UK, in England in particular. So there could be more. There could be other organisms that are associated with this, and indeed, we still need to know more about this disease. What is particularly strong now is that there is no note of any toxicology agents that have been identified to cause this mysterious hepatitis. And because of the beginning knowledge about this infection, and there's not much concern yet to cause any restrictions to declare any restrictions in international travel and trade. So what is known about the adenovirus? Well, it is rarely associated with fulminant hepatic failure in healthy children. And usually when does one talk about a fulminant hepatic failure to be present? This is in a situation when there is rapid deterioration of the liver function on a previously well child, resulting in coagulopathy and encephalopathy, usually within 8 weeks of onset of symptoms. And there could be certain factors that have been, theorized to cause the increase in vulnerability. It could be increased community prevalence of the adenovirus, abnormal host susceptibility, such as lack of previous exposure because of maybe of the lockdown that we've had for 2 years, and the priming by a previous infection or co-infection by other pathogens. So the list can grow, can be more than these that have been so far being theorized. Having, dealing with as mysterious hepatitis when the possibility is still, when the possibility of the etiology is still under investigation, how are we to respond? First, I think what is important is for us to really raise the awareness of the disease. And the recognition of the clinical symptomatology, I believe, is most important. And looking at the World Health Organization working case definition, they so far have identified two definitions linked to this mysterious hepatitis. A probable case of mysterious hepatitis would be someone with presenting with acute hepatitis with non-hep A to E, non-hepatotropic, with serum transaminases of more than 500 international units, AST or ALT, who is 16 years old and younger since the 1st of October 2021, referring to the Alabama cases. Or the epidemiology-linked definition would be a person presenting with an acute hepatitis, which is non-hepatotropic, of any age, who is a contact or a close contact of a probable case since the said date of October 1st, 2021. So importantly, just as in any infectious disease, it is crucial for us to emphasize the importance of adherence to the general risk mitigation and infection control strategies. And these we are quite familiar with the COVID-19 epidemic. So regular hand washing, respiratory hygiene, avoidance of exposure to potentially sick individuals, and of course, increased in our own personal host resistance. What about vaccination? Is this possible? Well, vaccination against adenovirus is actually available. However, it has only a very limited reach. It's only available for United States military personnel, and this is not available to the general public. It actually contains the subtype in question, subtype 7 of the adenovirus, including type 4. It comes actually very convenient to use. It's given orally, 2 tablets, taken at the same time, swallowed as a whole, not chewed or crushed. That would present a problem if we're giving this to children, and in the current formulation. And this also is recommended by the U.S. Department of Defense for military recruits entering basic training and other military personnel at high risk for contracting adenovirus infection. So as far as increased host resistance is concerned, what is important is to make sure that our liver is not unduly stressed by other agents that are potentially harmful, so that if we can take hold of protection against hepatotropic viruses through vaccination, and so far we have vaccines against hepatitis A and hepatitis B, we need to make sure that we all have had it. Proper diet and exercise, and avoidance of drugs and agents that are potentially hepatotoxic. Okay, what is the status of our hepatitis B vaccination in the country? This is the latest that I could call from the DOH website. In 2020, they reported that overall for the Philippines, we have about 74% coverage for all 3 doses, and this will be children below 1 year old. And if we would like to, if we were interested to see how the impact of the pandemic has been on the coverage of hepatitis B, I'm quite pleased to say that we haven't really slackened in this. Although, except for the NCR, there is really a not much deterioration or compliance or lack of compliance in the vaccination. But you will find that in NCR, maybe because of the greater number of cases that we have identified in the NCR of COVID-19, there was really and the lockdown as well, there was really a fear for having infants or even their children come out for vaccination. How about for the other infections? If we look, for the other vaccines, for the fully immunized child in the Philippines, this would be covering these sets of vaccines before the age of 1 year. You will find that, again, not much impact in terms of COVID-19, except for the NCR. So I think we are quite, we should congratulate the DOH for even for coming up with strategies to cope with the problem of the lockdown due to the COVID-19. So let me end my talk with these 3 key points. The cause of the mysterious hepatitis is still under investigation, but it may be closely linked to a non-hepatotropic virus, possibly more of this adenovirus. Young children with the median age of 2 years are most susceptible. Fulminant hepatic failure will necessitate prompt liver transplantation, and therefore recognition should be very crucial. Heightened awareness of the clinical symptomatology, adherence to general risk mitigation through infection control measures, and increased host immunity are important strategic responses for the general public. Thank you very much for your kind attention.
Oh, thank you very much for that excellent presentation. That's Dr. Juliet SIO-AGUILAR, and you're gonna see Doc Juliet, no, merong mga emoticons na hand clapping and hearts, no. I think it was so clear, very well developed, and I think it spurs more interest, no, that we would like to know more what will happen later on. But thank you so much for that presentation. Raymond, over to you.
Thank you so much, Ma'am Juliet. Not everybody knows this, but Ma'am Juliet is the predecessor po of Dr. Stella Jose. She used to be the Deputy Director for Health Operations at the Philippine General Hospital. So thank you again, Ma'am Juliet. For our next presenter po, no? But before I forget, we really encourage everyone to start typing in your questions in the Q&A box of the Zoom po and in the comment section of our Stop COVID Deaths and TVUP Facebook pages and also in the TVUP YouTube channel. It's my pleasure po to introduce our next speaker. She is a gastroenterologist and hepatologist, and she is also the head of the liver unit at the Makati Medical Center and also practicing gastroenterologist and hepatologist at the Asian Hospital. So please welcome to your screens Dr. Eternity Labio. Dr. Labio?
Yeah, good afternoon, Dr. Raymond. Thank you for that introduction. So can you hear me very well?
Yes, loud and clear.
Yeah, all right. So if you would allow me to share my screen. All right. Hold on. Okay, can you see that now?
Yes. Go ahead.
Right. Okay. So good afternoon, everyone. So I would like to thank the organizers. Special thanks to Dr. Stella Jose for the invitation to be part of this special edition webinar. And yes, I'm happy to be part of the 100th webinar today. So these are my disclosures, none that are relevant for this talk. So I would also especially thank the previous speaker, Dr. Juliet SIO-AGUILAR, for my former professor at the UP College of Medicine, for describing the cases of acute hepatitis of unknown etiology in children that has been recently reported across several countries. And hopefully we will handle this current hepatitis outbreak using the lessons we have learned from COVID-19 to help us prevent another pandemic from happening and prepare us, if ever, for the next one by coming up with a global action plan to counter future health emergencies. Because, of course, learning from COVID, we have learned the hard way that these diseases knows no borders and that none of us is safe until all of us is safe. And so after all, we live in a world at constant risk. And this slide just shows you an annual report from the Global Preparedness Monitoring Board, which is an independent body that ensures preparedness for global health crisis. And this is convened by the Director General of the WHO and the President of the World Bank. They're mandated to chart a roadmap for a safer world. And as you all know, health security is a big thing now and has emerged as an important concern for everyone. Because we live in complex environments where our health is a priority and it's exposed to constant threats. As you can see in this slide, humans, animals, and our ecosystem interact and interface in unique ways. So in this slide, you can see that we see massive displacement of people due to migration for all sorts of reasons. You see migration due to armed conflicts in Syria and Ukraine, for example. We witness deforestation and the way we eat and slaughter animals in wet markets, for example. And all these things allow animals and humans interact in unique ways where novel viruses can mutate and cause disease. So while we are still piecing the story together, as we've heard from Dr. SIO-AGUILAR, and that there are still a lot of questions that remain from this mysterious hepatitis, whether this unexplained hepatitis outbreak affecting hundreds of children now can be controlled or will evolve into an epidemic, hopefully not, or even a full-blown pandemic. We should remain focused on the problems that are well known to us, particularly here in our country, that 1 in 10 adult Filipinos are infected with a more common hepatitis B virus, which has affected millions in the Philippines and which makes our country considered to be hyperendemic for hepatitis B. And based on a national seroprevalence study we published in 2013, way back, it is estimated that around 8 million Filipinos, or 1 in 10 Filipino adults, are infected with the hepatitis B virus and are unaware of it because most have no symptoms. So I hope that clarifies a lot of the questions, yung mga katanungan nyo po in the polls kanina. Most of patients with hepatitis B have no symptoms. They do not have jaundice or yellowing of the eyes and skin, and most actually feel healthy. So I hope that answers a lot of the questions for the man on the street. No? Hindi po lahat ng may hepatitis ay naninilaw. So in fact, most of the cause of liver cancer in Filipinos are because of hepatitis B infection. And since the prevalence of hepatitis B infections in the Philippines is high, the Hepatology Society of the Philippines, which is the Association of Liver Specialists, came up with a consensus statement in 2014 that recommended that lahat po ng mga Pilipino should be offered screening for both hepatitis B surface antigen and its protective antibodies, so anti-HBs, and if you test negative, should be vaccinated if you are negative for both. And in spite of these recommendations, certain challenges remain, and there are still millions that are infected but remain undiagnosed and undertreated. And with only a third are aware of their infection, and because the liver is a silent organ, most patients have no symptoms, wala pong nararamdaman. Only 15% are actually seen by a doctor, and even less receive antiviral treatment. So finding the missing millions has been a global awareness campaign by the World Hepatitis Alliance, spanning different countries, including ours, to tackle the barriers to testing and diagnosis. And according to the Global Burden of Disease study published in The Lancet in 2019, the Philippines is among the top 20. So nasa top na naman po tayo, top 20 countries in the world with the heaviest burden of viral hepatitis B and C infections. And so in the next 15 minutes, I would like to highlight the value of early diagnosis and treatment in liver disease, and then move on to present some of the most common liver diseases in Filipinos. And finally, and by advocating towards minimizing the impact of acute public health events, such as this new one that we have, the mysterious hepatitis following the COVID-19 pandemic that actually endangers not just the collective liver health of Filipinos, but overall the health of the Filipino population. So in general, liver disease can actually remain very silent for many years, with most patients having no symptoms, and may not be diagnosed until the advanced stages where physical signs of liver decompensation, such as jaundice, yung hong paninilaw, ascites, paglaki po ng tiyan, bleeding, encephalopathy, or liver cancer arise. So therefore, late diagnosis is very common, and early diagnosis when there are no symptoms is actually infrequent. So however, screening and surveillance of those at risk will enable treatment, limit progression, avoid complication, and reduce costs. So unfortunately, most adults, including children with liver failure, suffer from late diagnosis from a variety of causes. So in this slide, you can see the consequences of liver failure requiring intensive care at the ICU with multiple organ support leading to death without liver transplantation, which brings us to the importance of our liver. So unlike the gallbladder or the appendix, which our surgeon friends and colleagues take out all the time, we cannot live without our liver. So our liver is a silent but hardworking internal organ, oftentimes neglected. It is our body's filtration and detox center, which clears our blood of toxins. It also serves as a factory of essential substances, such as bile, that helps us digest our food and helps our blood clot. The liver also plays an important role in our metabolism by breaking down fat and processes the sugar that we eat for energy. So having said all that, we need to be aware and cognizant of the three main causes that damages our liver and the three main causes of liver disease worldwide. So these are excessive alcohol consumption, chronic infection with the hepatitis B and C virus, and obesity associated with fatty liver and its progressive form called NASH, or non-alcoholic steatohepatitis. So among Filipinos, adding to the problem of viral hepatitis B, which I have alluded to earlier, is the increased prevalence of diabetes and obesity. So at the national level, based on this 2018 Food and Nutrition Research Institute survey, or FNRI survey, as much as 37% of Filipino adults are overweight or obese. And there's also an increasing prevalence of type 2 diabetes, above 8% as of 2019. So this leaves more and more Filipinos at risk for fatty liver disease and NASH. And those with type 2 diabetes and obesity are at increased risk for NASH, which is the progressive form of fatty liver characterized by liver inflammation and liver cell injury, leading to advanced liver fibrosis in as much as 40 to 50% of cases. And having liver fibrosis or scarring in the liver, what we all know as liver cirrhosis, is the most important predictor of death in patients with fatty liver or non-alcoholic fatty liver disease. So in addition to fatty liver, alcohol, and viruses, there are other conditions leading to hepatitis, which is really the general medical term for any condition leading to inflammation of the liver. So there are bacterial infections such as salmonella, typhoid, leptospirosis, and certain medications as well, including herbals, dietary supplements that can cause liver injury and hepatitis. So hepatitis is defined as an elevation in liver enzymes above the upper limit of normal. So elevated ALT, AST, and alkaline phosphatase. So the most common viruses that cause inflammation of the liver are the hepatitis A, B, C, D, and E. But there are also other viruses, such as the Epstein-Barr viruses, the adenoviruses, and the herpes family of viruses. But these are typically known to cause respiratory or gastrointestinal illness and are not known to cause hepatitis in normal, healthy children and adults. So as Dr. Shaw mentioned earlier, one of the main lines of investigation coming from earlier alerts for this mysterious hepatitis was a signal pointing to a possible association with adenovirus. So leading scientists to hypothesize that a normal adenovirus combined with a cofactor such as COVID-19 led to a more severe and atypical clinical presentation. Although a causal link has not yet been established, we are seeing cases above what is normally expected. So as a review, although these viruses, hepatitis A to E, all end up with hepatitis, they have different ways of transmission, prevention, and treatment. So hepatitis A and E are transmitted by eating contaminated food or drinking water. So from the questions from the man in the street, parang yun po ang kaalaman ng madami, nakukuha ang hepatitis sa maduming pagkain. So I think yun lang po, I think the misconception that we need to correct, that a lot of Filipinos know that all hepatitis is because of food. So this is just actually the A and E that is actually supportive and self-limiting and largely occurs in outbreak settings, while it is really hepatitis B and C that lead to chronic liver disease, liver cirrhosis, and liver cancer, which are transmitted by infected blood and body fluids. So there's really a lot to do in terms of raising awareness and getting a good understanding for the general public. So with a vaccine for hepatitis A and B and available effective antiviral therapies for hepatitis B and a cure for hepatitis C, I think we can now advocate to eliminate hepatitis as a public health threat, which brings me to my third and final point, that we all have a role to play to advocate towards minimizing, to promoting activities and programs towards the collective liver health of Filipinos and minimize the impact of acute public health events such as this mysterious hepatitis outbreak and the ongoing COVID-19 pandemic. For example, what can we do? We can promote and implement the government mandate to implement the birth dose of the hepatitis B vaccine in our practice, in our hospitals, which has been in place since 2010 by virtue of Republic Act 10152. This intervention has prevented majority of mother-to-child transmission of infections in most high-income countries, low middle-income countries. Dr. Shaw has shown data, but I think there is much to be improved. I think the country average is still hovering for the birth dose between 50 and 70%. We can still push it up to at least 90 to 100%, which is really the WHO target. All pregnant women should also be screened for hepatitis B by simply doing a blood test for the hepatitis B surface antigen or HBsAg, and if found positive with a high viral load, they should be considered for antiviral treatments such as tenofovir to prevent mother-to-child transmission during childbirth, in addition to receiving the birth dose of the vaccine. And I think this poster for World Hepatitis Day, endorsed by the Department of Health and the Hepatology Society of the Philippines, really captures this very important message. Sa unang 24 oras, bakunahan si baby kontra Hepa B, driving the point across that mothers can protect their children from getting infected because a safe and effective vaccine is available, and that no infants should grow up only to die of hepatitis B and its complications because they were not vaccinated. And so the WHO developed a strategy to eliminate viral hepatitis as a public health threat by articulating its targets, and that by 2030, 90% of infants should be vaccinated at birth, 90% of people diagnosed and aware of infection, and 80% of people eligible to be treated. And even with the current COVID-19 crisis and this new mysterious hepatitis outbreak, we can't wait to act on viral hepatitis, just conveying the urgency of efforts to eliminate it as a public health threat. I mean, if left unchecked, both Hep B and Hep C will continue to find new people to infect and continue to damage the livers of those already living with the virus. So every July 28 is World Hepatitis Day, which is an opportunity for all of us to raise awareness and give visibility and better lives for people living with viral hepatitis. And in the Philippines, we do have an additional month to spread awareness. January has been declared as Liver Cancer and Viral Hepatitis Awareness and Prevention Month to ensure that we have a comprehensive education program on the relationship between viral hepatitis and liver cancer. Because without early diagnosis and proper treatment, hepatitis B and C cause about 60% of liver cancer cases in the country. And this is why liver cancer remains to be the second leading cause of cancer death in the Philippines, next to breast, lung, and colon, as shown in this slide. And while breast cancer is more common, the mortality rate or the likelihood of dying from breast cancer is much lower compared to liver cancer because of late diagnosis when it comes to liver cancer. But the sad thing is, most liver cancers can be prevented by getting vaccinated, tested, and treated early for hepatitis B. And even for those living with the hepatitis B virus, there are effective and safe therapies available to stop the disease from progressing and reduce the risk of cancer. However, there's really a lack of public knowledge, as you can see from the video clips earlier at the start of the webinar. And there is also stigma and discrimination that have prevented many from getting tested and diagnosed. And even young, healthy individuals are declared unfit to work and denied employment because they were found to be hepatitis B positive. And so all the way back in 2010, we worked with the Department of Labor and Employment to actually implement a workplace policy against discrimination of workers on the basis of being hepatitis B positive. So aligned with the United Nations SDG goals to combat hepatitis, we at the Hepatology Society of the Philippines launched the Be Aware campaign all the way back in 2014 to raise awareness about the silent but overlooked epidemic of hepatitis B in the Philippines, for which we have a safe and effective vaccine and therapies available. So we believe that by giving the public correct information, we aim to rally everyone to be aware, be tested, be vaccinated, and be treated. So if you're interested to have more information, please visit our websites, which are listed here. So from hepatitis B, we move on briefly to talk about hepatitis C. Because now people with hepatitis C can be cured within 3 months by taking new oral medications called direct-acting antivirals. However, like the story with hepatitis B, because most people have no symptoms, hindi po sila naninilaw, many people still do not know they are infected, and many of them do not seek treatment. So this slide shows you the burden of hepatitis C infections worldwide. With the Philippines, nandiyan na naman po tayo sa top 20. And although the prevalence of hepatitis C is much lower than hepatitis B, current estimates show that 6 in 1,000 Filipinos are infected, approximately around 600,000, a much lower number than Hep B. And risk factors include transfusion of unscreened blood and blood products prior to 1990 and IV drug use. But the good news is we now have oral direct antiviral agents taken for 3 months that are effective for genotypes 1 to 6, with cure rates approaching 95 to 100%, even in difficult to treat patients. So recently, in 2020, in collaboration with the WHO, the Department of Health issued guidelines and integrated hepatitis B and C services at the primary care level in certain areas like Region 3, in Bataan, some parts of Metro Manila, to strengthen referral services. So these are demonstration projects provided free antiviral therapy subsidized by the government to treatment eligible patients with Hep B and Hep C. And hopefully these will be expanded to cover more and more areas and more patients. So to summarize, hepatitis B infections and its consequences are preventable by an effective and safe vaccine. We should screen for hepatitis B by requesting for just a blood test for HBsAg and anti-HBs at every opportunity, and vaccinate those who are seronegative. An effective antiviral treatment is available to reduce the risk of cirrhosis and liver cancer. And for hepatitis C, we should screen and test for it because it can be cured, and we should treat it because management is simple. And we should be an advocate for eliminating hepatitis C. And overall, we should be proactive in eliminating viral hepatitis in the Philippines. So with that, I'd like to end and thank you very much for your attention.
Okay, thank you so much. Muted again. Okay, thank you so much. That's Dr. Eternity LABIO from Makati Medical Center. Again, excellent presentation, and I hope you'll watch it again, no, and look at the details. Just so for Dr. Juliet and Dr. Eternity, our audience are mainly doctors, nurses, health professionals who are all over the Philippines at the level of districts, at the level of our tertiary hospitals, laboratories, and as you can see, we also have quite a number of people who are watching from outside of the Philippines, and I'm sure they really appreciated your presentation. Thank you so much. That was very illuminating. So we started out talking about a mysterious hepatitis event that's happening, and then we now ended up with talking about something that's so common and so prevalent in the Philippines, hepatitis B. So I think this has been very educational for everyone, and we are now going to go to our panel discussion, and we'd like to ask our speakers to open their cameras and their microphones, but Raymond has an announcement. Raymond, go ahead.
Before we go ahead with answering any of the questions, we will move on to our special public service announcement. Take it away, TVUP.
Aloy, bilisan mo! Dali!
Wala!
Ha? Ano nangyari? Ba't hindi kita makapitan?
Handa ka na ba, Kaloy?
Oo naman, ate! Nabakunahan na kami! May powers na kami laban sa inyo!
At hindi nyo na kami basta-bastang makakapitan! Yehey!
Sisiw!
Kaya mga bata, magpabakuna na kayo.
Stay safe and stay well. Mga bata, magpasama na sa Bakuna Center. Thank you so much, TVUP. The COVID Communication Public Service Announcement is one of the many creative outputs developed by the team, the Stop COVID Deaths webinar series team, to push for pediatric vaccination for children aged 5 to 18 years old. We hope you'll be able to share this video clip in all your social media networks. And stay safe and stay well. Magpasama na po sa Bakuna Center. Over to you, Dr. Susie.
Yeah, Raymond, thank you so much. I think there are some who are interested in using that video. Paano ba yun, Raymond, if they want to get a copy of the video?
Opo, I think, well, some of them have already emailed po Dr. Susie, but there are those, I'm not sure if there is already an SED short for that one. I'll ask the TVUP team to make it
Yeah,
available
kasi
po.
somebody asked me, di ba sometimes sa health center meron silang TV na meron silang
Yeah
mga
po, that's looped in.
pinalalabas.
Opo.
Oo, gusto daw nilang isama yung mga cartoons
Okay.
natin. Galing ng
Opo.
TVUP, no? Yay!
Nasa ano daw
Very
po
nice.
it's in the YouTube channel of TVUP. So,
Okay.
I think they'll be able to find it out there.
Okay, so let's get the ball rolling. I think we have some questions from the audience, but let me start by asking our two panelists. No, I think one of the main messages, and we saw this also on the person on the street interviews, was that there's not enough information out there about hepatitis, and so I guess the question would be, what do you think we should be doing to heighten the awareness on this, especially now that we're keeping an eye out for a very different type of hepatitis, no? So what do you think we should be doing? I mean, our audience are doctors, nurses, pharmacists, dentists. You know, they're working in the hospitals. No, what are your suggestions? So let's start with Juliet.
Actually, it was a surprise for me to hear from some of the people who were interviewed that the knowledge about hepatitis is not yet clear. So again, it is very important for us to incorporate. If we have any, any public information for other diseases, we should really be more proactive in educating our public through, the social media, or even any any of the tri-media or quad media, to heighten the awareness, and not only for their awareness but also for vaccination, for compliance with the vaccination, even for adult catch-up vaccination if they're still susceptible. I think there should be an organized program for this, knowing that this is still, it seems to be not yet completely understood by many of the people in the streets.
Right.
So it should be proactive.
Dr. Eternity, you clearly have an advocacy perspective in your presentation. So what do you advise for our frontliners who are listening right now?
Dr. Susie, I couldn't agree with Dr. Juliet about the importance of raising awareness. And we've really been in the business of raising awareness since 2014. But I think more than awareness raising, I think the government should really invest in testing and treatment services. And I think the pilot projects by the Department of Health in integrating hepatitis testing and treatment services in the primary care level in collaboration with the WHO is really a huge step forward, because I think health shouldn't be seen as an expense, but really an investment. And I think investment in testing and treatment services in the primary care level was really a wise investment forward, rather than allocating costly resources in spending for treatment of end-stage liver disease. And I think awareness can only do just as much, but I think investment in early diagnosis and early treatment will really go a long way.
Yeah, so Dr. Eternity, what's your take on the resistance to mainstreaming it? I mean, it's almost a no-brainer, right? We know how to diagnose it, we know how to treat it. We have a lot of cases, but we're only pilot testing it in a couple of regions. What's the barrier?
Well, I guess there are too many answers to that very difficult question. I guess it is a global campaign, finding the missing millions. Like, for example, we have the vaccine, we have the therapy, we have the cure even for hepatitis C, but where are where are the people, because they don't come to care because they have no symptoms. So really, it's really getting the people at risk. So liver cancer and liver disease is unique because it happens in people with chronic liver disease. It doesn't happen randomly. So we should use that to our advantage because we have a catch population that are at risk, and yet we couldn't zero in on them. So it's really screening and surveillance of a focused population, so that we can get to early diagnosis. It's very challenging. It's a global challenge, but I think we should learn from countries. For example, Taiwan, who has who is a country model in terms of primary prevention, secondary prevention. And I think we should look at those countries who have done very well.
Oh, okay, thank you. Raymond, let's pick up some questions from our audience.
Yes, thank you, Dr. Susie. And this, what we have been seeing po, no, medyo kalat-kalat lang po in terms of what's seen on Facebook and YouTube. There's one here in the Zoom, medyo related din po. If you have hepatitis and you've been treated for this one, are you eligible to donate blood? And how soon can you donate blood po? So we'll post that to Dr. Juliet na lang kasi she's been advocating for vaccination po.
For patients who have had hepatitis B infection, for instance, there are I think the policy is that if you're no longer a carrier, you should be safe enough to be able to donate blood. However, I know there has been some limitations in the actual level in blood centers that they, once you are diagnosed as having had hepatitis B, then they would not accept you anymore. I don't know if that is a pervasive observation, but transmission is basically with when you are a carrier. Transmission of the disease is basically when you are a carrier. So if you've completely cleared out your infection, then it should be safe to be able to donate blood. But I know there is a limitation. I'm not very sure about the reason for this in some centers. Maybe Eternity, would you like to throw in some more points there?
Yes, Dr. if I will. So HBV positive and HCV positive blood donors are not allowed to donate. But clearly, like you've said, those who have past resolved infections would be allowed to donate. So meaning they don't have current infections. So meaning they are HBV negative and HCV negative donors. So there is routine screening in place in our blood banks. So in that way, we avoid transmission of donor infections.
Yeah, I have a question here, Raymond. No? What is the risk for hepatitis for our frontliners, for our health workers? And what do they need as protection? Maybe Juliet can answer, and then, oh no, adult, right? So it should be Eternity. Yeah. What about our frontliners? So we've got, all our frontliners here watching. What's their risk, and what kind of protection do they need?
Yes, thank you for that question, Dr. Susie. Frontliners that really are at really high risk and should really be vaccinated for hepatitis B. They should be tested, and if seronegative for both, they should be vaccinated because they are at high risk for hepatitis B exposure. So that should really be factored in every time they enter the healthcare setting.
Yeah, so that's like a basic thing we should have. But I don't know that that all our health workers are vaccinated. I don't know. Maybe our audience can reply to that, no? Kasi ano nga, high risk, ano, it's a high risk group. Okay, Raymond, over to you.
Thank you, Dr. Susie. This one, and just because our topic last week was on boosters, this one comes from Maria Aurora Carlo Ortiz. She is asking if you've completed your hepatitis B vaccination series in childhood, how likely are you to to need a booster? Is there no need for boosters or testing in your adult years? Dr. Juliet?
Yeah, let me answer that. Generally, we do not recommend any more boosters, even in the adults, especially that we still are a country where hepatitis B is still endemic. So somehow you continue to get this natural boosting in the naturally, natural boosting. So unless you kind of like screen yourself and then you notice that what we do in the clinic is, for instance, somebody gets screened and that even with a history of hepatitis B vaccination having been completed, and that there is really no protective antibodies already for, let's say, hepatitis B, what we do is that to give one additional booster dose for that particular patient, and then do a test for antibody titers for the S antigen to see if there will be some response to it. If there's a response to it, then that's it. We just give one dose booster. But we don't do it routinely as of now.
Yeah, I have another pedia question here. No, my daughter developed an allergy to the hepatitis B vaccine. Swollen face, ears, and had to be brought to the emergency room. Does that mean she can't take take that vaccine anymore?
Well, I think it has to be confirmed whether or not that it was a direct relationship. Yeah. So I guess it may have to be, there should be a close supervision with the allergologist in case they may want to do some further evaluation, whether it was really because of hepatitis B. It could have been concomitantly, occurring at the time when the patient had, or when the individual had the vaccine.
Had an allergy.
So,
I mean,
so it's very hard to pinpoint as of now.
Yeah, go ahead. Sorry, go ahead.
Yeah, it's hard to pinpoint whether it is for certain that the patient had allergy to the hepatitis B vaccine. So it really needs to be evaluated, more clearly, more closely. Okay. So I guess my recommendation there is to consult an allergist, for it, to make sure that the details about the reaction is really related to the hepatitis B vaccination. So far, it's not been a very prominent observation for allergy to hepatitis B vaccine.
So it could have been something else. It could have been something else.
And many times we would have this already initiated at birth. So, and then by 6 months, they would have completed already. What we probably may want to emphasize that in the Philippines, especially those who go to the health centers for their vaccinations, their third dose of hepatitis B vaccine is given at a relatively earlier stage rather than at 6 months minimum, so that the antibodies may actually wane more quickly and not provide for for protection, for long-term protection. So we always emphasize that the third dose of the vaccine for hepatitis B should not be given earlier than 6 months of life. So you need to have the first two as the primary dose, and the third is basically still can be considered as a booster, so that you get this very nice anamnestic response after a period of a gap. So make sure that the third dose of hepatitis B should be given at not sooner than 6 months.
I see. So a little older, no? I have another question here. This one is for Dr. Eternity. Can you talk a little about hepatitis that we get from eating street food. Which type of hepatitis virus is this? And what kind of food is risky?
So that is really hepatitis, largely hepatitis A and E, which is really transmitted through contaminated food and drinking water. So this is what I mentioned earlier po kanina in my talk, that it largely occurs in outbreaks, and to protect yourself, please have yourself vaccinated against Hepa A. The vaccine is available, it's safe and effective. For hepatitis E, we have a vaccine, but it's not yet available here. But it would be hopefully soon enough. But for hepatitis E, hepatitis A, please get yourself protected. What food? Mahirap pong masabi kung ano yung mga yan eh, no? So you just really have to practice good hygienic practices. Be careful with what you eat. Cook your food properly and protect yourself. I think that's really the best way. Prevention.
Okay, I have one more question here before I turn back to Raymond. Hepatitis B, is it sexually transmitted?
That is one route of acquiring the infection, but the most common route in our country is still mother-to-child transmission at birth. And this is why with Dr. Juliet, we advocate for the birth dose of the hepatitis B vaccine, because that is very effective in preventing the major route of transmission.
Raymond, over to you.
Thank you, Dr. Susie. This one for Dr. Eternity also. And just because there are those who are citing the recent BMJ journal by researchers from the UK and Canada, does the acute hepatitis of unknown origin that we're talking about, ito po ba ay either resulta ng pagkakaroon ng COVID or dahil po ba to natusukan ka ng COVID vaccination? Just to be clear po.
Is that a question for me or Dr. Juliet? But I'm happy to chime in if that was.
Go ahead, ma'am. Go ahead.
Okay, so there's really not a lot that we know, but from the cases that we know, none of these children, Dr. Juliet, you can add on to this, but none of the children has received the COVID-19 vaccine. So fortunately, there has been no link to the COVID-19 vaccination so far. Second, if there is a link to COVID-19 infection, so there is a proportion of these cases that had previous COVID-19 infection, but not all. So again, these are associations, but not causal links. So iba po yun eh, yung baka lang nagkataon pero hindi pa siya causally related. So iniimbestigahan pa. So mahirap, we cannot make conclusions, definitive conclusions at this point. The story is evolving.
Even for the adenovirus, we are not even sure that it is really linked to it. It's just that the association is higher for the adenovirus. And also we noted that in the report in the UK that we also had a few cases of association with COVID-19. But what was really among the cases that were reported, but majority of them did not have COVID-19 vaccine because these were. You might remember that the median age of the cases of this mysterious hepatitis is in the very young. The median age is 2 years. So most likely they were not given any of the vaccines.
So it looks like it was more like that may have been more of a natural infection.
The ones who it was not related to none of them actually had any COVID vaccine, those who had the hepatitis of unknown origin.
Yeah, Dr. Juliet, while we're talking about this, so you had singled out, sort of emphasized Indonesia, where you said 5 out of the 15 cases were children who died. So it looks like the clinical course is quite severe.
Yes.
But and you also mentioned that in some of these cases they had to do liver transplants. So is that what does that mean that we do not know, we cannot treat it yet?
Oh, I don't know the details about the 5 cases with the 5 deaths among the Indonesian patients, because I was not able to access any of in the literature that I tried to, but I just wondered where, in which part of Indonesia did they have these details, like did they have access to a facility where they could even give care, supportive care even at the beginning part of the infection. So I really cannot comment very much on this, but you will note that even among the cases in the US, there were actually 5 out of 100, over 109 cases who had who died because of this disease. And in the average, they had about 14% of cases who had to be transplanted. So I mean, had to undergo liver transplant. So I guess it's the timing that if there were more cases in the UK who had contracted the disease and none of them died. So it's a matter of how good, how astute they are in the response to really making give supportive treatment among those patients who had fulminant hepatic failure, and then to even proceed further to go for liver transplant.
And then, Dr. Juliet, what do we know about the adenovirus that's involved? How is that transmitted? Is it respiratory?
It could be respiratory, it could be GI. So these are the usual routes of infection. And having said that, the finding of being affecting the liver has really not been a common event. So that's why we call the adenovirus, if it affects the liver, it's a non-hepatotropic virus, because it's not the usual presentation of the disease.
So it's something really novel, right? Something new that's happening that we're still trying to understand. No, that's how we would look at it.
We just have
Raymond,
to follow through.
Yeah, we'll follow through, and we'll follow up with both of you when new things occur. No, I mean, I recall when SARS-CoV started, they were talking about 200 cases in China. Nobody cared. But after a while, I'm not scaring the audience. No, huwag kayong matatakot. We just want to be updated. We just want to know and monitor what's going on. Okay, Raymond, maybe we have one last question, and then we're going to start wrapping up.
Thank you. We actually have 2 more questions, Dr.
Okay,
Susie.
sige, 2.
Okay.
Two.
This one comes from Nurse Annabel Petalbo Gabotera. So she's a nurse since 2016 to 2019. Her serologic check has shown anti-HBs titer of 1,000 milliteratural units per ml. Last December, she got her hepatitis B vaccine. So, totoo po ba that time will come that her antibody titers will decrease? She got again her antibody titers last March, and it's now at 43,409. So, normal daw po ba yun?
Okay, Dr. Eternity yan, adult.
Opo.
Those are very, very high, fantastic antibody titers, more than above what we will be jumping up for joy. So, and if she is immunocompetent, there is no cause for worry. So that is okay. You don't need to monitor. That is good. So just be reassured you can sleep well at night.
Nice. Okay.
Okay.
Okay, one more.
The last question po comes in, I think this is from Dr. Ian Soriano. Because of the increasing incidence of obesity and diabetes in the Philippines, do you see non-alcoholic steatohepatitis and non-alcoholic fatty liver disease becoming a bigger cause of cirrhosis in the Philippines. Now, question 1. Question 2, do you see the various societies coming together to create a unified set of guidelines regarding this po? Opposed to both Dr. Eternity and Dr. Juliet po.
Actually, we do see a lot of patients, even in pediatrics, coming in with some form of fatty liver disease as young, among the adolescents. So we really caution them to make sure that they look after their overall health. And I know many decades ago, it has already been projected that liver cancer in the future will actually not be not primarily be related to infection like hepatitis B or C, but will be really more related to obesity. So we have to really step up. And obesity is not a problem of the haves. Even the have-nots have a big problem because you will find that even the people in the lower social income group, a lot of them, we see a lot of obese patients as well. And this could be because of the nature of the food that is accessible to them. Sometimes it's cheaper, and healthy food is actually cheaper and provide more for the family. So I guess it's a lot of education that we need to give also to the general public about what is a healthy lifestyle, what is healthy eating. Exercise is also important.
Yeah, I'd like to thank Dr. Soriano for that excellent question. I think he just cast a spotlight on another emerging emerging health problem that is bound to hit us if we don't focus our attention to it. And I think the nods of Dr. Juliet and Dr. Susie just really affirms that it is indeed an important public health problem. So yes, we should really put our heads together and how we should be addressing this from a multi-sectoral perspective, definitely pediatric, adult hepatology, and endocrinologists. And yes, I think this is something that should be a topic for our discussion in future webinars for TVUP. Ayan, nag-volunteer na. Yeah,
Anytime. Anytime.
Anytime,
yeah.
This is a great topic for discussion and to raise awareness and get a better understanding of how we can solve this emerging problem in the future. Yes.
Thank you. Raymond, I have an input here from Michael Raquel because we were asking this question about vaccination of health workers. Doc Susie, in our hospital, Quirino Memorial Medical Center, our doctors require all incoming employees and all to be hepatitis B vaccinated. I believe this is already protocol for all government hospitals. Thank you for that information, Michael. So that was the question. No? So I hope sa private, ganun din. Ano? So sana talagang mabakunahan lahat ng mga health workers natin. Okay. Okay, Raymond, I think we have to start wrapping up. We're going to give our... we're going to answer the quiz first. Sige, Raymond. I think our guests already answered, but let's go through it again.
We'll ask them again just to reiterate po. So can we have it? Okay, Slido. First question po, no? This one for Dr. Juliet. First question in our fun quiz, which of the following are associated with hepatitis? Ma'am Juliet, please give the right answer.
Majority of them got it. All of the above.
So for our Zoom po, 35% of those who answered, yun po ang pinili po nila, all of the above. For our Slido inputters, if you will, 56% naman po ang pumili ng all of the above. For our second question, lahat po ba ng may hepatitis ay naninilaw, nagkakaroon po ng jaundice? Ano po ang tamang sagot? Ulit, Ma'am Eternity?
Resounding no. Resounding no. No.
So this one po for Dr. Labio po.
No.
No daw, Raymond.
The answer is no.
Yeah, the answer is no. Taka, nawala si Raymond.
Frozen.
Okay, while we're waiting for Raymond, there's a question from the audience. Okay, I would like to ask a question. This is from Ellen May Monson. In dialysis patient, if an event where the dialysis patient was accidentally hooked to a HEPA B machine, what's that mean? Is there any way na mahawaan siya ng hepatitis provided the machine was always disinfected every after use? Oh, I'm not so clear what the question meant, but would you like to comment on that?
Yes, I think I can answer that. So this is why it's dialysis patients are considered high-risk patients and they are vaccinated, part of the high-risk group. So if you are vaccinated po, you don't need to worry, even if there are accidents that happen in the healthcare setting. So kaya nga po, sinasabi namin kailangan pong magpabakuna para kung may mga ganitong pangyayari na hindi natin naiiwasan, you get exposed to something, you are already protected. Yun po ang una. Protect yourself, get vaccinated. And then I think that answers it. Kung hindi po kayo nabakunahan at unsure kayo sa inyong antibody status, please consult your nephrologist in the dialysis unit and they can check your antibody status and whether or not you were unduly exposed, and they can give you post-exposure prophylaxis. Meron pong protocols ang mga dialysis unit at ang ating mga ospital kung ano po ang kailangang gawin in the event of exposure.
Okay, thank you very much, Dr. Eternity. All right, so we are going to give our guests a couple of minutes to formulate their parting words for the audience. And while you're doing that, we are going to flash the our panel evaluation poll. So Raymond, you're back on. Please go ahead.
Thank you, Dr. Susie. Sorry for the glitch. This one is a 5-question evaluation poll po, no? It's a 4-point Likert scale. The statements read: the panelists demonstrated thorough knowledge of the topic. The panelists were well prepared and organized. The panelists spoke clearly and audibly. The panelists used appropriate language to technical medical jargons adequately explained. And finally, the panelists contributed to new perspectives and knowledge on managing various key health issues. As mentioned at the top of the coverage, we are not sending out separate evaluation polls or questionnaires. Ito na po iyon. So we hope you'll be able to enter your answers po for this evaluation questionnaire. And while you're doing that, and obviously we will not be closing this one, we would like to tell everyone po, if you have some spare time, maybe you're nagko-commute po kayo, maybe you are patulog or anything of that sort. If you have the time, please feel free to visit the YouTube channel of TVUP for what we call yung ating mga short, very very consumable po ng mga videos, the SCD shorts. These are 1 to 2 minute videos po, no, or thereabouts, and really distilling the very important messages for each of the topics for the previous webinars that we have had. Over to you, Dr. Susie.
Okay, thank you so much, Raymond. So let's go to our parting words. So first, let's have Dr. Eternity to give her parting message for our audience.
So first of all, I'd like to thank everyone for allowing me to be part of this webinar, because I think it's an opportunity for me to raise awareness and having the public get a better understanding of chronic liver disease, whether from Hep B, Hep C, alcohol, or fatty liver, and that it is a silent killer with no symptoms that quietly damages our liver, that eventually leads to cirrhosis and cancer. And I think we should see liver health and health in general not as an expense, but as an investment for ourselves. And then I think we all have a proactive role to play in eliminating viral hepatitis in the country. So I think we should get ourselves, or I think our families, our communities, find out our status, be vaccinated, get ourselves tested, get ourselves screened if we are at risk for liver disease. I think that would be my message for today.
Thank you so much, Dr. Eternity. And we'll go now to Dr. Juliet. Please, your parting words.
Yeah, thank you too for the opportunity to be part of this webinar. While we may not know much yet about the mysterious hepatitis, it has actually given us the opportunity to talk about what is important even in the local setting, that not many people are aware about, even what we thought were common knowledge about hepatitis B, how this is acquired. And so there's a lot for us as clinicians or even healthcare workers to be educated ourselves if we are not too certain about certain matters, and maybe to emphasize about vaccination, because vaccination, whenever possible, should be promoted not only for hepatitis, to prevent hepatitis infections, but also for the other diseases. So, as a pediatrician, I would like to continue to promote all the available vaccines in the country, so that we have to make, once we make ourselves better suitable to fight all these infections, then we don't have to worry about a whole lot of things, so that when the mysterious hepatitis come, maybe our bodies would be better able to fight, our host immunity would be better able to fight against the potential viruses or etiologic agents that come our way. Thank you very much.
So that's Dr. Juliet SIO-AGUILAR. Thank you so much. Thank you to our speakers. On a personal note, I mean, I like listening to the gastroenterologist, because my late father was a gastroenterologist also, and I can almost hear him through your words. So thank you so much for your time, for researching on this, and for being willing to share the information, even if it's still very limited. And we will take you both up on follow up discussion on liver disease and hepatitis. So we're going to have our summary by none other than the Deputy Director for Health Operations of the Philippine General Hospital, Dr. Stella Marilia Gaspi Jose. Stella, over to you.
Good afternoon, everyone. First of all, I'd like to thank our...
Stella, open your camera. Open your camera.
Ayaw siya mag-open. Teka, sandali. Ayan, okay. First of all, I'd like to thank our speakers for coming in today. Excellent lectures from both of them. I would just like to summarize some salient points. From Dr. SIO-AGUILAR, she mentioned that hepatitis can be infectious or non-infectious, and we have the hepatotropic viruses, hepatitis A, B, C, D, and E, and then non-hepatotropic viruses, so that is Epstein-Barr virus, cytomegalovirus, adenovirus, even dengue, and SARS-CoV-2. So there's also the bacterial cause for the infections, and the non-infectious are substances, immunologic problems, metabolic, that is the NASH, that is non-alcoholic steatohepatitis, and ischemic or vascular causes. Now, the highlight of the cases of this presentation, she mentioned that in children, the age range was from 1 month to 16 years old, and the mortality rate was 2.4% and 6.8% had liver transplant. And the presenting symptoms are fever, jaundice, vomiting, respiratory symptoms, and more importantly, a very markedly elevated liver enzymes, yung ALT and AST. And she also said that the non-A2E hepatitis, 70% of the patients presented with adenovirus, whether it is coincidental, but that was the findings. And some were also associated with SARS-CoV-2 and Epstein-Barr virus. So What she's saying is, at this point, we're not yet so sure as to the exact etiology, but the findings showed that 70% were caused by adenovirus. So what do we know about adenovirus? She said that there is rapid deterioration of liver function in a previously well child, and this causes coagulopathy and encephalopathy. So what is important here is the recognition. So a person with so the probable patient is the person presenting with acute hepatitis, which is non A, B, C, D, or E, and the serum transaminases are very high, more than 500 IU per liter. So the key points in her lecture are the following. The cause of this is still under investigation, but it may be very closely linked to a non-hepatotropic virus, such as the adenovirus. And she said that young children are most susceptible. So the median age in this report was 2 years old, and the patients get pulmonary hepatic failure, which necessitates liver transplantation. So as you know, in our country, liver transplantation, we do it here in PGH, but we haven't done it in children yet. No? So this is a very abroad. So they already had so many children who underwent liver transplantation. I think she mentioned uh, uh, like 10 or 12 already, no? So it is a significant operation that they do to save the life of the child. Okay, so we should have heightened awareness to the clinical symptomatology. We should adhere to the general risk mitigation like hand washing and increase host immunity. As to the lecture of Dr. Eternity Labio, she recommended that all should be screened and vaccinated against hepatitis B. I also adhere to that policy, no. And she said that the Philippines belongs to the top 20 most heavily infected with hepatitis B. She emphasized the early detection, the early diagnosis and treatment, and she said that 40% of compensated patients with hepatitis are asymptomatic. So they do not know that they have hepatitis, but in fact they do. So she emphasized the importance of our liver. She said that the liver is a filtration and detoxifying organ. It is the factory of substances and it is a metabolic center. Now, she mentioned three important causes, the main causes of liver failure. So, excessive alcohol intake, viral hepatitis, and obesity. So this causes cirrhosis of the liver and later on liver cancer. And many Filipinos are at risk for non-alcoholic fatty liver disease and also NAFLD and NASH, which is non-alcoholic steatohepatitis. Okay, so she mentioned the different types of hepatitis, A to E, and the A and E, those are the foodborne types, and it will disappear by itself, self-limiting. B and C, it's you get it from contact with blood or body secretions. Okay, so like in OB, because I'm an obstetrician, the mothers are screened for hepatitis B. So we get the anti-HBs and we get the HBs antigen. And we give vaccination even in pregnant women beyond 12 weeks. So we can do pre-exposure prophylaxis or post-exposure prophylaxis. So we give the vaccine. So now there is that trend to do medical management. For example, the viral load is very high. We also refer to the hepatologist, to Dr. Labio and to others like her, so that they can be given tenofovir. So this will stop the destruction of the liver. Now, the key points to the talk of Dr. Eternity Labio is number one, hepatitis B and its consequences are preventable. So it can be prevented by an effective and safe vaccine. And number two, the screening for HBs antigen and anti-HBs at every opportunity. And we should vaccinate those who are seronegative. And number three, effective antiviral treatment is now available to reduce the risk of cirrhosis and cancer of the liver. We should be proactive in eliminating hepatitis B in the Philippines. I'd like to mention also for the comment of Dr. Michael Raquel from QC and MC. I agree with you that because all government hospitals, we already give hepatitis B vaccine and we get the titers. Even our interns and incoming clerks, that is one of the requirements. They should submit the titers, the antibody titers, and also the proof of vaccination. Thank you very much. Back to you, Susie.
Okay, thank you very Thank you very much, Stella. So si Stella, si Benji, tsaka si Charlotte. Naku, ang galing talagang mag-summarize, no? Parang parang ewan ko paano nilang nakukuha lahat yung information na yon. But thank you so much for that excellent summary. And we again like to thank our guests for today. But next week, okay, wow, exciting. Next week, Stella mismo ang presenter natin. So si Dr. Stella Jose is going to talk about pregnancy, lactation, and COVID-19. Alam niyo po, maraming mga buntis o kaya nagpapasuso na nanay, no, na ayaw nilang magpabakuna, or kung nagka-COVID sila, ayaw nilang mag-breastfeed, no? So we will have clarity on how do we advise all the moms who are pregnant and lactating on what to do. Okay, what to do if they get COVID? Do they get vaccine? You know what? Should they, of course, we know they should get vaccinated. But ano ba yung mga haka-haka ng mga nanay natin, no, mga kaba nila, so that, and to have the right answers for you so that you can answer them and you can guide them. So we will talk about pregnancy, lactation, COVID-19, and we're going to have Stella as our presenter, plus somebody who will be talking about milk banks. So may connection to sinasabi ni Raymond kanina na wala ng infant formula. Kung may milk bank tayo, hindi na kailangan yung infant formula, di ba? Okay, anyway. Breastfeeding advocate ako eh. Sige, Raymond, over to you. So see you on next Friday. Don't miss it. Yeah.
Thank you so much, Dr. Susie. Before we conclude our program, meron po, you're seeing on the screen the results of our evaluation poll. So, at least 95% po, makikita nyo po, of our evaluators or those part of our audience chose strongly agree for all of the 5 questions in our evaluation. Maraming salamat po sa inyong lahat. We'd also like to acknowledge the very hardworking team behind the Stop COVID Deaths webinar series. Without each and every one of you, we won't be able to churn out our quality content week in and week out. Rest assured, hindi po tayo matatapos sa ating webinar 100 at patuloy po tayong magsisilbi at magbibigay po ng impormasyon para sa lahat po na miyembro ng ating credible online community. For all those who are asking also, na para po mapanood po nila yung mga episode na ito, yung mga iba pong mga episode na dati pa po, you can view all of the archive webinars in the YouTube channel of TVUP. If you go open your browser and type in www.youtube.com/TVUPPH, you'll be able to see all 99 webinars, and then thereafter our 100 webinar for today. Maraming salamat po ulit sa inyo lahat. Sana po marami po kayo natutunan. It's really an evolving topic po ang the acute hepatitis of unknown origin, and we hope that's something that we will keep an eye out. We will also strive to give you the latest news in and around the world po dito po sa ating Stop COVID Deaths o webinar series. This formally closes our webinar for this week. Magkita-kita po tayo ulit again next Friday from 12 noon to 2 p.m. It's a date.
Together, we can stop COVID deaths.
So keep safe, keep healthy, and see you online!